just don't listen it what I say. What are the important tips I'm going to share today in the session? I want you all to make notes. Okay, if you just now, otherwise you can later on go through this recorded session and then probably you can make notes, whatever is your wish. But this is really important what I'm going to tell you today. And of course, if you will keep these points in mind, it would be very easy for you to score at least 350. Of course, you can get more than that, but if you will keep these points in mind, it's not difficult to get it. Okay, and what I see, the where the candidates are still losing, it's not listening and writing, it is reading. So I request everybody, I shared the strategies. Those who did not attend the session, you guys can go through the recorded session, it's in the Skype. So, but please practice a lot. Okay, so that's what I don't want you to lose even marks in reading or listening. That's very important. Okay, so I'm gonna share the screen. Yeah, let me know you guys can see that. Yeah, this session is a recorded session, so you guys can get through the recording whenever you want. And let me know that you guys can see the screen, right?
Yes, ma'am.
Everyone?
Yes, no, ma'am. I can't see.
Who can't see?
Linda.
Linda. Linda, you are in India, out of India?
Out of India.
Out of India. So do you want me to, will you call me, or how do you want to do? Because I think your connection gets better when you call.
Yeah, I will call you.
Okay?
Okay.
Anyone else who cannot see the screen? Okay, let me see if she joins back. Yes, Linda.
Still, I can't hear, ma'am. See, I can't see.
You can't see. If you can't see, then it would be really difficult. Because this is a PPT which I can't even share in the group. Is it something written on the screen that it is presenting something?
No, same like before, nothing showing. Like a black screen.
Black screen, huh? You're on mobile?
Yeah. Yeah.
Can you join on a laptop if you have? Possible?
That is not no, out of order, not complain that one.
Okay, okay. Anyway, let me try. I'm disconnecting again. Let me just start again.
Yeah,
Yes.
now I can.
Now can?
Yeah.
Okay, thank you. I was worried what to do. Okay. All right. Okay, so what we are gonna discuss today. Okay, let me tell you, as I came to know from the last batch, as the guys were struggling here and there for the CBT, I do provide the training for the CBT and for other courses. Okay, so in case if like they said, Rajbir and everyone that they were not aware. Anyhow, so if you guys have any questions related to the further processing or further queries on your thing, I can share that with you. Okay. All right, so in this session, what we are going to discuss is that how to approach a role play, okay? And especially the time management, make the most of your time. As you know that in starting you will have 3 minutes, okay? So demonstrate the assessment criteria, that how you are gonna implement the assessment criteria, as we have discussed the assessment criteria in the previous sessions. You know that there are two types, right? We did linguistic and other one is which one? Yeah, one is linguistic.
Communication.
Communication.
Yeah, clinical communication criteria. Yes. Okay. All right. So there are two types of assessment criteria which we have already discussed. Okay, and I'm gonna share some important points from that as well, and practice the role play. So we will definitely take one role play and we'll do practice of that, and we will learn from each role play and the settings, that how we can utilize the background information and everything, how to start it basically. That is what you are going to learn today. So let me make you it very clear that some of the candidates get confused. Ma'am, I wasn't able to finish the whole task in 5 minutes. It doesn't matter at all. They are not gonna deduct your marks for that. But yes, how did you start the role play? Was that really effective? Or did you utilize the assessment criteria in that? That's what is important. Let's say if I'm doing a speaking role play with the examiner, and when I started, the interlocutor maybe said everything in the starting, and the way I start, how interesting, how effective, if I used all the checklist of the assessment criteria, you know, and let's say I missed two tasks at the end because the 5 minutes over, I will still get B. Remember that. So starting, as we always say, first impression is the last impression. So first impression when you start is very, very important. So keep that in mind. You all know about the time rule, that there are two role play that you will get in the exam. There is a warm up round before that, but it's, I think, very rare nowadays any interlocutor asks any warm up question, they directly give a card. But even if they give, just a basic question about yourself and what you do, why you have chosen, you know okay, so guys, you can mute from your side. You can unmute in case if you want to ask any question. Okay, thank you. So the two role plays, and then you have to speak for 5 minutes, and the prep time, of course, is 2 to 3 minutes. So total 20 minutes approximately. It could be they could finish even in 10 minutes, 10, 12 minutes. Okay, so making the most of your preparation time. Now, how to utilize that preparation time of 2 to 3 minutes, because that's what where you are gonna score the maximum if you will plan in a better way. All right, so this is a basic healthcare conversation which I'm trying to show in the slide. Is when you have a patient in any setting, even in a OPD setting, in a IPD setting, or you have emergency setting or a home visit setting. Now, what is important when we receive a patient as a nurse? We definitely do an assessment of the patient. Yeah, so we ask that, okay, what happened? We do an assessment, then we ask a couple of questions. So asking the questions and doing the clinical examination, all is a part of assessment. Okay, and then what we do after that, when we ask question, we reassure that don't worry, okay, I'm here to take care of you. That reassurance word is very important, remember. Okay, this will give you 3 score, 3 band 30 score. Very important. Explaining, then after that you have to explain everything to the patient, the advices basically, and of course the persuade, motivating the patient to follow that advices which you are sharing with or explaining to the patient. So this all points are very important in the healthcare conversation. So please remember this. And please note down, if you guys are making notes, it's good. So remember these points is very important. You can take the picture of this as well. There is a image sign in on your screen. You can click on that and take a camera icon. So you can take a pic from that, or you can make a notes as well. Okay, so this is a healthcare conversation, and these points are really imperative in your speaking role play. Okay, so moving further is a planning, how we do a planning of the setting. What are the setting, as I just mentioned, there are different kind of a settings basically for OPD, IPT, emergency and home visit. And there are some background information, that is the paragraph which is given, that's called body paragraph. So how you have to start the conversation, it all depends on the information given in the body paragraph. You will take the lines from that. So that's very important, that you read it carefully, you underline the keywords, the main words, and then you can plan, okay, how I'm gonna start. So what you are and how you're gonna think in that 2-3 minutes is quite important. You can make a notes, you will get the pencil and a paper, you can make your notes even. Okay, and then you will get the list of tasks, like basically they nowadays have 4 bullet points or 6 bullet points. All the information is always given in the bracket, and remember, you will not apply your own knowledge. Whatever is given, you have to say that. Okay, so we will discuss about this in more detail, but before that, now this is very important, so please note down how to start the conversation. How to start it, very important. Of course, you all know that you have to greet the patient and clarify the patient's name if needed. If you remember, we did a task earlier in which we were checking the patient assessment, the level of consciousness during the recovery time, right? So at that time you need to clarify, and in that case was the one. Another case, let's say we did recently, the patient has undergone a recently test yesterday, maybe today morning, and now to collect the reports. So before discussing the health reports or reports with the patient, you want to verify the patient name, that you're talking to the right patient. So that's also, so wherever it is required, you must verify the patient's name. Very important. And especially in a home visit setting, when you go there, am I talking to Mr. John? Because you don't know, you are at a home visit, there could be 4 or 5 family members in that, and you don't know to whom you're talking. So you want to confirm to whom you're talking. So in that case also, the verification of the name is important. Right? So greeting is, of course, as per your time. Like, I know that most of you have a habit, even though we have an evening session, you guys say good morning. So please remember during the exam time, because the exam is always after 1 o'clock. Okay, so 1 to 2 o'clock, if somebody has exam, you can say good morning. Oh, sorry, good afternoon. Yeah, so when you come till 4, you can say good afternoon. But after 4, if you have a time, 4 p.m., 4:35, 6:30, like that, go on, you can say good evening. So please keep the time in mind. Don't say good morning at 4 o'clock. Okay, so keep that in mind. I often heard that when during the class, you guys often say good morning, even in the evening class. Okay, all right. So keep that in mind. Very important thing. Second, introduce yourself. That my name is so and so. Now, again, it depends. Let's say it is the known case that we did yesterday only, in which the patient is readmitted for the surgery. Probably the patient knows you, or you are at a home visit. You have already visited the patient 2 weeks ago, and now you are visiting again to check the status or condition of the wound. So in that case, you don't need to introduce again, because it's your task says clearly that you visited the patient 2 weeks ago. Okay, so in that case, it is not required your introduction. But if you say it's not wrong, okay, they are not gonna deduct marks, but yes, the presence of mind shows that you are not alert. Okay, so read that carefully. Now, third point, clarify your role in their care. What you are gonna do. Clarify your role, what you're going to do. Let's say if it's a patient in emergency, he say I have this and that. We'll say, okay, so yeah, so don't worry what I'm gonna do. I'll just clean the wound and we'll do the dressing, we'll give you some pain medications, like that. You're going to clarify what you are gonna do. What's your role? Yeah. So then comes explain the nature of the interview if required. For example, what you're going to do further. You're going to discuss about what are the devices. Then you can say, let's say the patient has come here to collect the report for the cholesterol. We did one task in which the daughter has come with the mother's report of cholesterol. You can say, well, okay, what I'm going to do now, I will explain you what is cholesterol, what are the causes, and how we can control it effectively with the measures other than the medications, and why it is important to do. Now, this is very important. If you will include all these points in your speaking in the starting, you will definitely get at least 50-60 score is definitely from this. 3 3 3 3, yeah. Okay, so the score sheet which says about the clinical communication criteria which comes under this, it is very, very important. Let's take an example of this more in detail. Now, let's say this is the OPD setting, right? So in case of OPD setting, what you guys will do, like these are the 4 points listed on the left side, like greeting the patient, I said. Second is introduce yourself. So greeting the patient, for example, you say, hi Maria, good to see you again. Now, this is the OPD case where the patient is revisiting. We just did recently, the patient has already underwent a colonoscopy, a test, or any test, for example, and collecting here to collect the reports. Okay, or you can take an example in this case. You're talking to a mother, yeah, who is known his and she is here with Harry, his son, and his son is a regular patient of you, and now today he is presented with worsening of asthma. Now imagine a situation. Now this is very important. It's written, it's your regular patient, and today he has asthma since childhood. All the information given in the body paragraph, and then it'll say now today he is presented with the worsening of asthma. Of course, the mother will be concerned, worried. Yes or no? Yeah, mother will be worried. And
Yes.
now imagine yourself in the mother's shoes, that if I am a mother and I'm so anxious and worried because my child, who is just 4 years or 5 years, has a severe, is worsening with asthma, and you are asking me as a nurse, how are you, Maria, today? How do I should react? Do you think it is an appropriate response? Yeah? Yes or no?
No, ma'am.
No. So if in this situation where the mother is anxious, it could be anybody, any relative, okay, or even a patient himself or herself, and you'll say, how are you? That sounds like, oh my God, what's happening? So never say the statement, how are you today? That would be a very bad starting, remember. Okay, so you have to be very careful in selecting your word and reading it carefully. Say that, okay, hi, good morning. You know the patient. That's why you will say, hi, Maria, good to see you again. Yeah, but you can't say same thing if the patient is a first time. You can say, good morning, Maria. That's simply just say that. If it's not a known case. Let's say it is not a known case, it is a first time. You'll say, good morning, Maria. No, you will not say, how are you? You have to introduce yourself only if it is, if you know the patient, then introduction is not required. As I just mentioned previously, if the patient is revisiting you, your regular patient, a regular word is given there. In that case, the introduction is not required. Your introduction is not required. Let's say I'm a community health nurse and a regular patient of mine has come to me. If I'm introducing, that's wrong. You got my point? So if a patient is a new patient, then I will introduce myself that good morning, my name is Jocelyn Kaur. I'm the nurse in this community health center. Then that makes sense. Now, third point is clarify your role in the care. Instead of saying how are you, you have to be very, very specific by saying, okay, so now I understand, Maria, that Harry has experienced worsening of asthma, and you must be concerned, right? So, yeah. Like we did one task yesterday in which a patient of epilepsy. Remember, we did that yesterday. So patient has already seen a doctor and is worried about a long-term uses of a medication. I hope everybody remember the task.
Yes, ma'am.
Yeah,
Traveling case.
Yes, ma'am.
absolutely. So when, she has already seen a doctor, you don't have to do an assessment. Yeah, you don't need to ask a couple of questions because she's already diagnosed. Assessment is already done. In fact, the treatment is also done. So asking her questions for the assessment is wrong. Asking her that why you are here, what happened to you, can you explain in your own words? All wrong. How are you? All wrong. And you will think, ma'am said OPD, then we always start with that, how you are doing. No, it depends on a task. It depends on task to task. Her assessment is done, her treatment is done, and she seems to be worried and anxious when she's coming out of a doctor's room. She's depressed as she has to take the medicine for. So the best way to do, oh, Tina, well, I have just gone through your case notes and I understand that you have been diagnosed with that. I'm really sorry to hear about that, but don't worry. I'm here to help you if you need any explanation regarding, as I can see that you are looking concerned about it. So is there anything which I need to explain? Then she will talk about medicine. So same way here, you have to, that's what you are clarifying your role. You're saying that I understand that Harry has experienced worsening of asthma. You must be concerned about it. Is that right? It's yes. Now, fourth question comes, explain the nature of the interview. Explain the nature of the interview. Very important point, please. And I have noticed till now that very few of you use this. Maybe 1 or 2%. So please remember, this is very important that you explain the nature of interview by saying, okay, so what I'm going to do now is find out that what's going on so we can help him. Now let's patient, okay, so what I'm going to do now, first I will, will do, let's say it's a different case of the cholesterol, which I was saying. Okay, so first I'll explain you about cholesterol, then this and this and that. Now in this case, let me just check his, let me do a complete assessment of Harry, and let's check his condition, and then probably we'll give him the suitable medication. Doctor will come now and assess him in a short time. So you are telling her that what you are gonna do further. I hope these points are cleared.
Yes, ma'am.
Yes, ma'am. Yes, ma'am.
Yeah, I hope you guys are making notes.
Yes.
Okay.
Yes.
So when I hear your this speaking next time, I want all these points. Please practice. You have only 1 week, so please practice. See, this whole scenario will change. Now remember, here we are talking, yeah, if it's a known case, good to see you again. And what happened? We don't ask what happened. We say that I can understand. If the patient is so anxious and the condition is so sick, we never say, how are you? That's absolutely wrong. Avoid saying that. So then this is the best way. And remember your tone, very important. If the patient, now in this case, the mother is so worried, if you'll say, hi Maria, how are you? This tone is very loud and rude. Oh, I'm sorry, I can understand that Harry has experienced this asthma, but don't worry. I know that you're concerned, so let me just quickly examine you. Tone has to be very polite and low, depending on the condition of the patient. If it is given, patient has been recently diagnosed with cancer, you're saying, oh, don't worry, you will be fine. Wrong. That means you are not empathizing with the patient. You are not understanding the pain of the patient. When somebody is pain, the volume automatically get low. You 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 try to be soft and polite. Oh, don't worry. I can understand it must be hard for you. I hope you're getting my point.
Yes, ma'am.
This tone, rhythm, politeness, this all comes under linguistic criteria, equally important. Okay, so now see the same points we will do in a different setting. This was the known case or unknown case. Now let's take an example of home visit. Now look at the responses completely change. You're not gonna follow the same sentences, same phrases, what you're gonna say in different setting. Now this is a home visit. The points are same. You're gonna greet the patient. Hello, Mr. John. Is that right name? No, you're confirming that you're talking to the right patient. You can say, hello, am I talking to Mr. John? This is also a different way. Am I talking to Mr. John? But your tone, if you say, am I talking to Mr. John? Am I talking to you, Miss John? See, both tone has a difference. Did you realize the difference between both? So this is very important. If I'll say, good morning, Mr. John, probably you know the patient. Now, remember, again, as I explained earlier, if in the task it is mentioned, you have visited the patient, this is your regular patient, you visited the patient 2 weeks ago, and now you are again to check the patient progress. Then I don't need to say that am I talking to Mr. John. Then it is expected from you that you know the patient by face. You know that who is John and who is whom because you have already visited the patient. Then you can say directly, hi, Mr. John, how are you? So how you have been feeling since the last visit? No, this comes later, but yes, here you remember the difference in both. So this one Regular word, if it is mentioned in the task, will change everything. So read your task carefully. If it is written your first timing, if there is no word like regular patient or you visited earlier word, then consider it as a new patient, and then you can say, hello, am I talking to Mr. John? Or you can say, hello, it's Mr. John, is that right? You'll say yes. Okay, then you introduce your, okay, well, John, well, Mr. John, I'm the community nurse and my name is Tina. Give your introduction if it is a first case of visit. If it is your first visit, then clarify your role that I'm going to assess, or you can say, I'm going to check your condition now to make sure that you're doing okay. I hope it's okay with you. Or you can also say that, is this the right time to do that now? So yes. Okay, now explanation. Okay, well, what I'm gonna do, I'm gonna ask you a few questions to check your progress, or you can also say, well, I'm gonna ask you a few questions to ensure that everything is all right. Do you mind? I'll say no. Okay, all right. Thank you so much for allowing me to do that. Well, I just want to know that how you have been doing since our last visit. If it is a new case, then you can say that how you have been doing after since the discharge. See, we did in the OPD setting look at these points. My concern was very different. I started clarify role in a different way. I said, I understand Harry's condition and I know you are concerned and worried about it. And I'm gonna do this. And here now, entirely different. You're gonna say, I'm gonna ask you a few questions to check your progress and is everything is all right. So these 4 points are really important in every setting, either it's a home visit or an emergency or OPD or IPD. These 4 points are you will always include. Let me know if anybody has any questions till now. Yes? And this much of silence is dangerous. Yeah? I hope everything is clear to everyone.
Yes, ma'am.
Yes,
Yeah?
ma'am. It's clear.
Any questions till now? So can we proceed further?
Yes, ma'am.
Okay, great. Okay, so let's take this example of the task. It's given a setting state school. It's a school. You are a state school nurse. It's given in the, now this is called body paragraph. You are the school nurse at a state school. Ronnie Wilson, aged 8, has been sent to you quite frequently after school commences, complaining of tiredness and headaches. Okay, quite frequently. That means this Ronnie comes regular to you. Okay, he sparks up after a rest. Sparks up means he feels better. He feels better after a rest and some milk and biscuit. So what you suspect that he is regularly missing out on breakfast, although he says his older sister always looks after him well because his mother has to go to work. You have made an appointment for Miss Wilson, who is the mother, to come to your office at 9:30 today. So I know it is a school setting. I'm a school nurse. To assume a room in which you're sitting as a school nurse and you're talking to the mother. Because you have fixed an appointment, then of course, you know, Okay, so let me do. Before I explain, I want to know you guys to do this quick. You all have written these points. Greet the patient. Number one, please note down it immediately if you have not written. Second, introduce yourself. And third, clarify your role in the care. And fourth, explain the nature of the interview. Everybody has written these 4 points? Yes, great. Now this is a task and I'm giving you a time for 2 minutes. 2 minutes is actually too much. 1 minute. And you are gonna tell me all the 4 points which you are gonna, how you are gonna start this. Okay, my timer is gonna start. Okay, I can give you an extra 1 minute, a 2 minute probably. Okay, your time starts now. Okay, so 2 minutes over. Yes, who will tell me? Renu.
Yes, ma'am.
Yeah. So what are that first point?
Greet the parent, like her mother.
Hmm?
Yes, ma'am.
Yeah.
So
So tell me
so
how you will greet. These are the points. Yeah. How you will greet.
so ma'am, I'll say hello, good morning. Um,
Mm-hmm.
am I talking to Miss Wilson?
Mm,
No.
okay.
Okay, ma'am.
Okay.
So
All right.
secondly, ma'am, introduce yourself, like
Mm-hmm.
myself, Renu, and mm, um,
Mm-hmm. Yes.
and third point is, ma'am, clarify your role in their care. Like why I'm going to discuss some points regarding your son. Like uh, he have been complaining of frequently headaches and tiredness,
Mm-hmm.
which however he spark ups after rest or having some milk and biscuits. So
Mm-hmm.
I would like to know that what is the reason behind that. Could you
Mm-hmm.
please tell me?
Hmm. So what is the next point? Explain the nature
Explain
of
the nature
interview.
of interview.
Yeah, so what you will ask in that? What you will ask in the last point? Explain the nature of interview.
Ma'am,
I think we
ask
have
the
done this
reason.
task before also, isn't it?
Ma'am,
Okay. All right. So let me hear from Linda. Linda, be quick.
Yeah. Good morning. Hello, it's Mrs. Wilson.
Mm-hmm.
Is that right?
Yeah.
I am Linda Simon, a school nurse working in this state school.
Mm-hmm.
Um, first, next, clarify the role. I am going to ask about your son because he's having some problems in school, that tiredness and headache.
Mm-hmm.
And these are things I will tell. Then explain the nature. I am going to ask you some question regarding your son because I need some clarification from your side because he's having this and this problem. So I want, so we want to, I want to ask that question and I will explain what we can do for that.
Okay, well, that was fine, but we never use this word I want.
I am.
I would like. Never say I
I
want. Okay. All
yes.
right. Yes, Sasha.
Ma'am, may have some distraction.
No
Sorry to that.
problem. Okay.
Okay, good morning, Wilson.
Morning.
Hi. Ma'am, can I hear?
Yes, I can hear you.
Okay.
Please continue.
Yeah. Hi, good morning, Miss Wilson.
Good morning.
Sorry.
That's okay.
Hi, good morning, Miss Wilson.
Good morning.
My name is Rasha Skaria. I'm the school nurse. I've informed you to the appointment to meet to talk about your son Ronnie,
Mm-hmm.
as he had some complaints of tiredness and headache. I would like to ask you a few questions to get a clear picture of his condition. Is that okay, Miss Wilson?
Okay, all right, good. So you have finished this in 3 lines, 4 lines, which is quite okay. You talked about. See, this is how your speaking will be assessed. When you will start like this, I will, as an examiner, I will see, okay, you greeted the patient, you introduce yourself, you clarify the role as well. You said that, yes, I am a school, you clarified the role that why. In fact, your first task is this only, explain why you have arranged the appointment. So you're going to tell that, yes, I have arranged an appointment in view of Ronnie's health condition as he experiences quite frequent tiredness and headache in the school. And now that's what is, you are clarifying your role, that's why you called upon this. And what is the further point that is explain the nature of interview. So what I'm going to do now is I'm going to ask you some questions regarding his health so that we can conclude that what's wrong with him, why he has this problem so frequent. Is that okay with you? So yes. Clear? So you have to say in the same way, and as examiner I will judge you based on these 4 points, that are you including these points or not. And that's what, how it makes difference to your, then you ask question when she has given permission, that how is Ronnie's general health. We'll say this, okay, and what about his routines of his meals and bedtimes, this, okay, then you start discuss about this. You got the point now? I hope
Yes,
it's
ma'am.
clear to everyone.
I have one concern, ma'am.
Yes.
that the information has written that he packs up after the rest and some milk, right?
Yeah, yes.
Like that's information. Whether we can tell to her about this?
Of course,
Yeah.
yes, you can.
Yes.
Since it
Yes.
is given, that's what we need to use the information from the body paragraph.
Oh. Is it we
That's
can
what
tell in the initial time itself?
clarify. Yeah,
The
clarify your
nature.
role in the care
Yeah.
in that.
Yes. Yes.
You're
Yes.
going to clarify that I'm going to, I have fixed up an appointment as I want to discuss the Ronnie's health as he often complain of tiredness and headache. And when I offer him some milk and biscuits and he takes some rest and then he gets better. So I suspect that probably he's missing out his breakfast. So I would like to discuss about this. Now, I want to discuss regarding this and this. Is that okay? Is the nature of the interview. I hope this point is clear to everyone.
Yes, ma'am.
Yes,
Yes,
ma'am.
And anyone has any questions still here so that we can, because further
Yeah,
we're going to talk about the tips. Yeah.
ma'am, it's mentioned in the time also in that, right?
I didn't get time in the sense.
Because come to your
yeah,
office at
office at
9:30
9:30.
Okay.
today.
Yeah. Yes.
So
So
in
it's a
this
9:30
situation,
morning.
yeah. So if
Yeah.
it's like afternoon the exam, whether we can say the good morning?
Since it is written specifically 9:30, so you have to say good morning.
Okay.
Yeah, you have to say good morning.
Yeah, yeah.
Why they have there is a reason, because as a patient, as a
School.
mother, I have to answer. First of all, it's a daytime, it's a school time. Secondly, when she will tell her routine that I'm not aware about his routines because I leave home by 6 a.m. and I come back in the evening by 5. So why don't she'll answer you. That's how it makes important to give a time here, that she'll say, see, I have taken a special leave to come to fix up an appointment to come to meet you. I'm also worried about. So these statements will come from the mother side, and that's how they have specified it to you. But anyhow, this is the daytime. Of course, you will call her in the daytime. So this is how you will say, definitely, whatever's your time, you will say good morning.
So, ma'am, in this type of case, ma'am, we can say directly to Miss Wilson. Hi, good morning, Miss Wilson, because we have arranged the appointment, so we
Yeah,
know
you
the
know that
name.
it is absolutely,
Yes, ma'am.
Miss Wilson
Yes,
is coming
yes.
to see you. So then
Yes.
Mm-hmm.
there's no need to confirm that am I talking to you, Miss Wilson here. Now you start see here the tone difference. That's what I say when you watch some movies and the dramas, you get a lot of things from there. And this is how, if I'll say, hi, Miss Wilson,
Mm-hmm.
so good morning, Miss Wilson, how are you? So that is a one statement, right? When I say, hi, good morning, is this Mr. Wilson? So yeah, okay, well, thank you so much for coming. This is another way. Now, the difference in tone, I'm saying the same thing, but difference in the tone. So that's how, I mean, no need to confirm the name. It's not that important as you have fixed an appointment with Miss Wilson. So definitely that means you're talking to Miss Wilson. Okay. All right. I hope it's clear.
Yes, ma'am.
Yes, ma'am.
Great. So can we move further?
yes, ma'am.
Yes, ma'am.
Of course, ma'am.
All right. Thank you. So, okay. Now these are the tips we are going to talk about. Tip number 1, what you are gonna do during the prep time, as you have 2 to 3 minutes. You are gonna read everything. During the prep time, you're gonna ask the interlocutor that what to call him or her, how can I address you. Ask this before the role play starts. Okay. And like how you can say, excuse me, what do I call you in this role play? Okay, so this is the first thing that you will remember, to ask the name before you start the role play. Now, tip 2, like you have the same task, and now the what you're gonna see You're going to underline the setting. Okay, that's the first thing you are going to see, that what is the setting, because all the starting depends on the setting. Okay, how you're going to start, it all depends. It's an OPD, IPT, emergency, or what, because your statement starts as per that. Now, second point is urgency. How urgent the task is. Is it really important? You have to show that urgency to the mother here. And how, and tone, urgency can be shown in the tone. Even the words that you use, the tone that you use, she'll say, she will be very offended that I'm not responsible, I'm a working mother and I have to see a lot of things, I'm a single mother. Now her tone could be high, but you have to maintain your tone by saying, oh, I completely understand, Tina, how it must be difficult for you to look after the whole family, the economic aspects, and managing the house and work and two kids. I completely understand your condition, but don't worry. We both want the same thing. We both want Ronnie to feel better, right? So that's how you start the conversation. Now, when it comes to the urgency, you have to tell why you called up her at 9:30 a.m. Why so urgent? Because this is her office time. Now you will tell, well, thank you so much for coming to taking a time out of your busy schedule, and I understand the value of your time, but this was quite imperative as we I have noticed that this and this has happened when Ronnie comes to dad. Is this now? That is very important. Remember, please note down these points: setting, urgency, tone. These three things give you score. If you are telling it is urgent, you have to tell that why you called up her at this time. Why was it so urgent? I hope these points are clear.
Yes, ma'am.
Great. Now, number 3, understand the scenario. And that's the reason they give you a lot of information in the body paragraph so that you can understand it well. That who are the person to whom you are talking, what happened, and when it happened. Who, what, when. Very important. These 3 W's to get the better score. Okay, so you are going to tell to whom, you remember to whom you're talking. You're talking to a child, you're talking to parent, you're talking to sibling, you're talking to in a father is a patient or a daughter, a patient is angry. What is the situation? So who you are talking, you're talking to a daughter who's angry, and what happened because the father's surgery got delayed. Yeah, and when the things get happened, like what happened in case of an accident when the things happen. So who, what, when, very important. Okay, and moving to the tip 4, you have to be very attentive. Now, this is one of the important criteria. Be attentive. Can anybody explain me how you can, how the examiner, I'm I'm an examiner, not interlocutor. I'm just listening to your audio. How will I come to know that you are attentive?
We need to respond with
Mm-hmm. Yeah.
which each sentence like fine, well, like
Yes, yes. Use this because sometimes we just nod our head. I can't see you. This is not a video recording, this is an audio. So you have to use the words like, now, first of all, it is very important, never interrupt the patient in between. Let him or her complete the sentence. She's saying, oh, I had a terrible night. And suddenly you're saying, oh, I understand that. Let her complete her sentence. When she will stop, then you're gonna say, oh, I'm so sorry to hear about that. Don't interrupt the patient in between. Don't just jump to give a response. No. Wait till the patient stops. And then you respond. For example, when they say, oh, like we did recently, yesterday, I think it said in a lifestyle that I have completely quitted the alcohol and reduced the smoking from 10 to 5. So when she'll stop, then you say, oh, that's really great. I must appreciate you for that. You did a great job. And I'm just saying I've quitted the alcohol, and in between you are interrupting me. That's wrong. No points. Even if you said, oh, that's really good. Now, even though I will cut your marks because you are interrupting the patient. Negative impact. So let the patient complete the sentence, then only jump to the answer. And be authentic in your role as a nurse. Give a real picture. Let's have a real feel that you are a nurse. All right, so now this tip 5, very important. I think I've explained every time in the class also, and I'm repeating that today also, that keep in mind this similarly the settings are important, the body paragraph for the information is important. Same way, the task, if you guys will see that I have highlighted the task first points. These are called the verbs. Like first says explain, ask, discuss, make an appointment. Sorry. Yeah. So it's written explain, again ask, discuss, make. So explain means you are gonna talk first. Underline this task, okay? As I was explaining it yesterday also in the session, that when we say explain, that means you need to talk. Okay, so you are gonna start saying that why I have arranged the appointment, and then again ask us. That means you are gonna again start and ask the question. Discuss again, you make an appointment, you. And when let's say there is a point in between where it is written reassure the mother about Ronnie's health. That means you are not gonna speak now. Let her tell that what she feels, then she will give some statement, then only you will reassure her. That means you have to wait for the mother's response. You have to give a pause. Now, giving pause after every task is important because that indicates you're giving the time to the mother to understand what you are saying. And if she has any questions, she can also ask. You are giving that opportunity to ask questions. So remember these points in mind. You will always underline the verbs. You will see these are for me, or I have to wait for the mother's question and then I will have to respond. Then definitely, let's say there is no question from the examiner side. Then you can ask her, do you have any questions? Normally, examiner interlocutor should ask you a question. If he or she is not asking, do you have any concerns regarding Johnny's health? Then you can push her to ask a question. All right, but don't ask in between when it's written ask, and if you will ask, do you have any questions? No, that doesn't make sense because the ask is yours. This point is for you. Okay, so these verbs plays a quite important role. So please, when you get the role play in hand, this task, underline the setting, underline the important words, and especially the figures, like it is given aged 8, 9:30 today. Some important things like he missed out, you give milk and biscuit, he missed out the breakfast, sister prepare. So these are some important keywords to give up, which you want to look immediately when you speak. So underline that word. So these verbs will guide you that you have to ask the question to the mother or you have to say it. Okay. And now anticipate, tip number 6. What's anticipate meaning here? It's realize how the patient or relative might be feeling. You should anticipate. If you remember, we did one task initially, that there is a psychiatric, a 16-year-old, 17-year, 18-year-old girl with anorexia nervosa, was very clearly given in the body paragraph that she answers angry, and she behaves quite angry and upset, and will refuse to give any answer when you will ask about the diet. So when you have this kind of information, you can anticipate how the patient or a relative is gonna behave with you, how they gonna answer you, so that you don't feel nervous. If the examiner is talking in this way, might be it is written in her task that she has to give, not talk in a, she has to show her attitude. She is fussy patient, or she is worried or something regarding that. She's angry. From the body paragraph information will help you to anticipate that information, that how the patient or relative might be feeling has a very important. Sometimes it is given in the task, let's say admitted patient, and it is written, the patient is quite anxious. When these feelings are given, you must underline that point, and that will help you to start the conversation. Say, hi Tina, how are you today? Say, yeah, I'm good. Well, I can sense that you're looking quite anxious. Is there anything which is bothering you? Now that's where you anticipated her feeling, and you're asking if everything is fine. Best way to start with the feeling, if it is given. If the feelings are not given, like here in this case, if you read this task, it's just written that you have made an appointment, blah blah. Nothing is given that how the mother is gonna react, how she feels. She feels irritated that you called her up at 9:30 a.m. She is not very responsive to the Ronnie's health, or she's careless about Ronnie's health. Nothing is given. So that means you can't start like that. Then you have to start in a different way. So all these tips which we talked today, all these points, they will help you to understand how to start a role play. Okay. Now, last tip, but very important. I think, I don't know, I just shared this information with you guys yesterday, I believe, that I got a call from one of the candidate who recently gave exam. She was in from Kerala, and she said, and I was shocked. I never heard somebody scored 230. I still feel that maybe I told her, maybe OET has given it in a wrong way. Maybe it is 320, or by mistake they have written 230. You can go for reevaluation, because the English wasn't that bad. But she said, I just want to know from you that how much score they deduct if I have used medical jargon. She said, because in the whole task I used it frequently, that one word in both the task. So I want to tell you that this is very important. You can't ignore. If you are saying cholecystectomy, or saying, like yesterday we did a task and you said atherosclerosis, you talked about coronary angioplasty, if you're using all that information, no score. Remember that, because you are a medical person, but to whom you are talking, all are non-medical person. You are not talking to any medical professional in this. You're talking to either a patient or a patient family. All are non-medicals. So if you will use a single word from your jargon, you'll not get the score. Remember that. Okay, so always use simple language to explain everything. I always say it, keep in mind, imagine you are talking to your own grandmother. You always will talk polite, soft, and in a tone that she can understand, and you will try to explain her in a simple way so that she understands what has happened to her. So always use that kind of explanation to the patient or patient's family. Is that clear?
Ma'am, shall I
Yeah.
ask one? I
Yes,
have one
please.
concern.
Yes.
As you said about that anorexia case, no, related that if like the patient is reluctant, as a
Mm-hmm.
nurse, I don't have any clue in my card that she will be reluctant for some more time. For example, related that anorexia nervosa case, actually I
Mm-hmm.
expected in that card she will give the information about her diet. So next
Mm-hmm.
is our chance to speak. But sudden, as a patient, you have not given any information that. Then how
Mm-hmm.
we can progress that type of card? Because maybe the patient card will be there till the end of she will be reluctant, or in after one or two
Yeah.
questions she will be
Yeah.
okay. But we
Yeah.
doesn't know that we
Mm-hmm.
doesn't know that as a nurse we doesn't know that she how long she will be reluctant, so how we
Yeah.
can progress that type of cards, mom?
Good question. But why you did wait for such a long time to ask this question? We did this, I think, 2 weeks ago. So anyhow,
No,
you
I
asked
thought
before
you
the
are not.
exam. So
Yeah,
that's good. At
actually,
least you asked before the exam, not after that. Okay. All right. Thank you for asking this question. So let me explain. I think if you remember in a body paragraph, it was clearly given the patient will deny and will not accept that she has eating disorder. This line is very clearly given in the body paragraph.
yes, ma'am, that's clear. But as I thought that maybe that is the end of like we are giving the information about mental health like a
Mhm.
doctor. So I
So,
didn't expect. So sudden I stopped there. How I can
yeah.
progress there?
So that's what I'm trying to explain. When it is clearly written that she will deny to accept that she has eating disorder. Another case, as you said, in most of the cases, it is given till that at end the patient will accept. Then instead of the deny word, there will be mentioned reluctant. Then it will not be written deny. It will be mentioned in the task that let's say a patient Ronnie is reluctant to accept her diagnosis. Reluctant, that means at the end she will get angry. She'll understand, she'll accept it, she'll be agreed. But when it is written deny, that means there is no scope. And moreover, second clue, now this is the first clue. Second clue, it depends what is your next task. Like for example, in that it was given that tell her your um, reason of asking the question, therapeutic aim. You remember particular line, it's given in the bracket,
Yes,
therapeutic
ma'am.
aim of asking the
Yes,
question.
that was the confusion because
Yeah.
this again I asked, then again she reluctant.
Yes, and
Yeah.
it was given only one in the bracket. Tell her the you tell you said again that I have this. I again said no. And what was your next task? Next task was, you are explaining her to see a mental health doctor. Sorry, in other case where you have to still convince the patient, then it will be written explain her the importance of explain her the importance of sharing the information, or explain her the consequences of this disorder. Then next task will be like this. It is your task is role plays designed in such a way. If patient has to accept something, then of course your next task will be explain her the consequences, explain her the side effects or something like that. But in particular that task, it was written that this is advise her to see a mental health doctor, then probably that indicates to you that you have to accept her. When you tried your side and she said no, you say, okay, well, I understand your concern. I respect your feelings. However, I would like to advise you to see a mental health doctor, because that's what your next task. So this is the second clue. So remember and read in that way. I hope it's clear.
It's clear, ma'am.
So two things keep in mind. The word, reluctant word is mentioned, or deny. Second, what is your next task? If next task is talking about the same thing, that means you are giving her a second example. See, if you will tell me, then probably this will help you to avoid these and these severe consequences. That means you're going to try the second time. However, if nothing is mentioned related to that, you will not convince her next time. Because you don't have to add anything from your side. If it is mentioned in the task, you have to say the same thing. Got it? Okay.
Yes, ma'am, it's clear.
Great, thank you. So next is, I just want to end with this conversation because this is very important. If you understand this, then it is quite easy for you to achieve 350. It says initiating the interaction appropriately. That means how well you begin the conversation. Your score depends on that. As in writing, I always say your introduction and first paragraph will decide you will get C plus or B. Similarly, in speaking, how well you begin the conversation will decide you will get B or not. I'm repeating that again. If you have 5, 6 mistakes in a grammar, acceptable. If you missed 1 or 2 tasks at the end, your time is up, accepted. But if you are not following the criteria, you're not starting as per the criteria, will not get the score. And moreover, how do you react to the patient? Your tone. Are you giving a smile? How are you? Admitted patient, you're coming to the patient room, opening the door, and it's a good morning. Admitted patient. We cannot say this to the emergency patient, good morning. But we can say this to the admitted patient. Hi, good morning, John. How are you doing today? That smile, eye contact, your body language. Now, the examiner is not going to see your smile or the body language, but if you will speak like this, you will make an eye contact, then this will give you confidence and this will make your conversation naturally. It will come automatically. Okay, these things comes automatically when when you feel that you're talking, oh yeah, you feel natural, you're like you're talking to a friend, then your confidence level gets up and you feel it's like you're talking to a patient in your ward. All right. Okay, so just for your information that I deal with the various courses as well, CBT and other NCLEX. And you guys already have my number in case of any further query, so you can contact me. And now I'm open to your questions. Tell me. Come on, I don't like the silence, dear, please. I feel that you guys didn't get anything.
No, ma'am, it's clear. We can start. Hello?
Yes, it's clear?
Yes, ma'am, it's
Yes.
clear.
Yes, ma'am.
Okay, so in case if you have any questions, so I'm always there. So tomorrow also we will have a session at 7:30. Okay, so I'm gonna
Yes.
again talk about some important points. related to the writing. Okay, so those, I know, Masha, you are not for that, but you are still welcome to join me if you want. Anybody can join me for that.
Thank you, ma'am.
Yeah, but
Okay,
that's
ma'am.
gonna be an
Thank,
important session, so I want everybody to attend that. Yeah.
Thank you.
okay, ma'am.
Because
Thank you, ma'am.
my concern is not that you have joined me only for speaking or reading, then you do this and do this only. No, I want you to clear in all the other modules.
Thank you so
Yeah,
much,
Okay,
it's
ma'am.
ma'am.
really
Thank you,
it's
ma'am.
good, ma'am. Nobody is
Yeah,
telling like that.
actually.
Yes,
Yeah.
seriously, because I feel really bad when I heard from, I she got B in so well in writing 380 or so and lost in reading. So I don't feel good. Yeah.
Yes,
You guys
ma'am.
can
Twice
mute
I
from
You
your
have
side.
experienced the
you have a
same.
good heart, ma'am.
Thank
Yeah.
you for the kindness.
Yes.
No one will, no one will
Yes, ma'am. So
be
nice to
like
you,
that,
ma'am.
ma'am.
Anyway, thank you so much. But yes, I want, since there is only a week, so give your best. Whatever you have the time, this is the
Sure.
time to prove yourself. And this 4 or 5 days you have in hand. And I always suggest that don't touch your books before your exam. Your exam is on Saturday. Okay, guys, you can mute from your side. That's not their fault, Mama. It's your fault. You are not giving them time. It's your fault. What they can do. Okay, all right. So, best of luck and practice well. And see you guys tomorrow again, okay? At the same time,
Okay, ma'am.
7:30.
Okay, ma'am. Thank you.
Okay,
Right.
ma'am. Thank you,
So
ma'am.
if you have any questions, so keep that in mind. Practice this at home.